Welcome to another episode of Med Madness. Today, we will be discussing a sensitive but crucial topic, recognizing and addressing child abuse. As future healthcare providers, it is imperative to be vigilant and knowledgeable about the signs and risk factors associated with child abuse to protect our most vulnerable patients. In this episode, we will cover the risk factors, clinical presentation, and management strategies for suspected child abuse. Let's dive in. Next, let's discuss the risk factors. Child abuse is often associated with specific risk factors that can be categorized into three main areas: caregiver background, home environment, and characteristics of the child. Caregiver background. Young or single parents may lack the maturity and support necessary for effective parenting. Lower education levels can contribute to poor coping mechanisms and parenting skills. Substance use disorder in caregivers can impair judgment and increase the likelihood of abusive behavior. Psychiatric conditions, such as depression and impulse control disorders, can affect a caregiver's ability to care for a child safely. A history of childhood abuse in the caregiver's past can perpetuate a cycle of abuse. Next, let's discuss the home environment. Unstable family situations, including divorce and conflict, can create a stressful environment. Financial difficulties and job loss can increase stress and reduce the resources available for proper childcare. Lack of social support can leave caregivers without necessary help and advice. Domestic violence can expose children to traumatic experiences and normalize abusive behavior. Next, let's discuss the children. Children with physical, intellectual, or emotional disabilities may be more vulnerable to abuse. Unplanned pregnancies or children perceived as unwanted can unfortunately be at higher risk for abuse. Next, let's discuss the clinical presentation. When evaluating a child for possible abuse, certain clinical signs should raise red flags. Unexplained or implausible injuries, especially those in various stages of healing. Malnutrition or signs of neglect, sudden changes in behavior or academic performance. Now, let me share a real-life case study. Consider the case of a 7-year-old girl named Emily. Emily's teacher noticed that she had become withdrawn, her grades had dropped, and she often came to school with bruises on her arms and legs. Upon further questioning, in a safe and private environment, Emily revealed that her mother's new boyfriend had been physically abusive towards her. The teacher reported the case to Child Protective Services, and Emily was placed in a safer environment. This case underscores the importance of recognizing the signs and acting promptly. Next, let's discuss management. If child abuse is suspected, healthcare providers must document objective findings from the evaluation, report suspected abuse to Child Protective Services without delay, interview the child in a safe, private setting to encourage them to share their feelings and experiences. Speak with the caregiver alone to gather more information about the home environment, but prioritize the child's account and provide immediate intervention to prevent further harm. In summary, recognizing and addressing child abuse involves understanding the risk factors, identifying clinical signs, and taking swift, appropriate action to protect the child. As future healthcare providers, your vigilance can make a significant difference in the lives of vulnerable children. Engage with our pre- and post-podcast quizzes and use the Anki flashcards to reinforce your learning and ensure you are well prepared to handle such critical situations. Thank you for tuning in to Med Madness, and remember, your role in safeguarding children is invaluable. Stay informed, stay compassionate, and stay committed to making a difference. Until next time, take care.